COVID conversations on a Thursday, 4:15. We normally start at 6, but due to another very important outreach into the diaspora at 6 to discuss COVID matters in Jamaica, we had to move the time forward. So thank you again for joining us, and hope we did not cause any inconvenience. The Ministry of Health and Wellness has taken the decision in light of some of the feedback we have gotten, but also just looking at maximizing the take-up of vaccines for today, September 30th, to extend opening hours for the vaccine sites across the country. Kingston and St. Andrew, we will go on until 7 p.m. These sites would normally close at 4. So it's St. Joseph's Hospital, Good Samaritan Inn, Stony Hill Art Academy, Sovereign Shopping Center Boulevard. In St. Catherine, similarly so, 7 p.m., Greater Portmore Health Center, Old Harbour Health Center, Linston Anglican Church, Old Harbour Civic Center, and St. Jago Park Health Center. Trelawney, we will go until 8 p.m., Low River Health Center, Falmouth Health Center, and Rio Bueno Health Center. In St. Elizabeth, go until 6 p.m. at Independence Park, Black River. In Clarendon, 6 p.m., Denby Primary School, Spalding Health Center, and Maypen Health Center. And in Manchester, 6 p.m., Mandeville Regional Hospital and Christiana Health Center. In Portland, we'll go on until 7 at the Port Antonio Health Center. And in St. Mary, until 7 p.m. at the St. Mary Anglican Church Hall, Port Maria, and the Area 2 Police Headquarters, Pompano Bay, Tower Isle. In St. Anne, 7 p.m. at the Turtle River Park, Ocho Rios. Westmoreland, 7 p.m. at the Savlamar Health Center. St. James, 8 p.m. St. Catherine Hall, Health Center, and Sandals Inn and the Type 5 Health Center. So that's St. James, 8 p.m., Catherine Hall Health Center, Sandals Inn, and the Type 5 Health Centers. Hanover, 8 p.m., Hopewell Health Center, Lucy Health Center, Green Island Health Center, Ramble Health Center, and Sandy Bay Health Center. Persons, of course, should do the usual, take their vaccination cards, a government-issued identification or letter from a justice of the peace to the sites that they visit to access vaccines. So essentially, the extended hours will go from 4 in some instances to 6, in some to 7, and in other parishes to 8 p.m. So depending on the parish you're in, you can make contact or visit our website. And if you need to visit for vaccines, we certainly encourage you to use up the opportunity that is available with the extended hours. COVID-19 remains, of course, a clear and present danger to Jamaica. We must continue to observe the protocols that are in place. Hospitalizations remain high, while the number of infections and deaths obviously are regrettable and continue to be a challenge. In the last 24 hours, some 913 persons were in hospital. 650 of that number confirmed positives, and 263 suspected, 263 cases. Also, in the last day, the island recorded 251 new COVID-19 infections and confirmed, unfortunately, 9 deaths. The total number of infections since the first case was discovered last year now stands at 83,737, while the death toll has moved to an unfortunate number of 1,869. At this time, I will now ask our Chief Medical Officer to provide some better particulars on the COVID-19 numbers so that we get an understanding of where we are and what the trends are. Some encouraging, but nevertheless still concerning. CMO?
Good afternoon, everyone. So just to say again the numbers that the Minister has just said. We confirmed 251 confirmed cases yesterday, and so that would bring us up to 83,737 overall confirmed cases. We confirmed 9 deaths, and that would bring us to 1,869 deaths. Our daily positivity rate was at 20.7%, with the weekly positivity rate being at 26.7%. In terms of the age distribution of cases, we still are seeing that the greatest number of cases are in the 20 to 29 and the 30 to 39 age group. We know that there has been concern about what's happening in our children, and so we're trying to answer some of the questions that have been posed to us with regards to the children and COVID. So if we look at the 0 to 9 and the 10 to 19 age group, we see that the percentage in terms of the overall numbers is pretty much constant in terms of the number of children being affected versus the number of other age groups. In terms of deaths, we see again that our largest numbers of deaths are in the 60 to 69, 70 to 79, 80 to 89 age group, with the largest percentage of deaths being in the 60 to 69 and 70 to 79. To look at the children again, we would see that in the less than 10 and the 10 to 19 age group, the number of deaths are low. 4 deaths less than 10 and 8 deaths in the 10 to 19 age group, 0.2% of deaths and 0.4% of deaths, respectively. To look at how the children have, previous slide. So children represent 11% of all the cases of COVID-19 that we have confirmed, and overall 0.6% of the deaths seen. In the less than 1 age group, we would have had 644 cases, and this represents 7% of the total number of children that were affected. In the toddler age group, the 1 to 2 age group, we had 983 children that were affected. This represents 10.7% of all children, which is 0 to 17. Preschooler, 1,191 cases. That's 13% of the children. And school age, 6 to 12, 35.2% of cases fall in that age group, 3,238 cases. And in the adolescent age group, 34.1% of cases, 3,136 adolescents. So the larger number of cases that we're seeing among our children are really in the 6 to 17 age group. If we look at the number of deaths at the bottom of the slide, we would have had 1 death in less than 1 year olds. We would have had 1 death in the 1 to 2 year olds. We would have had 1 death in the 3 to 5 years olds, and we would have had 2 deaths 6 to 12 years and 6 deaths in the 13 to 17 years. So I must say that except for 2 of these deaths, all these children had comorbidities that would have made them more prone to a severe illness. Next slide. In terms of hospitalizations, again looking at the children, total hospitalizations that we've had in the categories of moderately severe and critically ill would have been 2,986. This is for all age groups. For children, we would have had 79 children, which represents 2.6% of this total that were hospitalized as either moderately severe or critically ill. Again, just to show what's happening with the children in terms of the cases, on this chart, the children 0 to 18 age group is represented by the purple lines at the bottom, and you would see that there has been little fluctuation in terms of the number of children proportionately that are affected for COVID. A slight increase, yes, we noticed that in the surge time, we would have had higher numbers of children being affected, and then it comes down a little bit in the surge. So in the first surge, we would have had 7.1% of cases were children. In the second surge, we'd have 10.7% of cases being children. And in the third surge, we had 11.4% of cases being children, a slight increase seen from surge to surge. Next slide. In terms of deaths, again, just to look at the children, at the bottom, we would have seen that outside of the first part of managing the pandemic, in the first wave, the second wave, the third wave, we've had very few children being affected. In the last surge, the surge we're presently in, we've had one death. And in the last surge, we would have had, I think it was 1 or 2 deaths that we had at that time. So in terms of the effect of COVID on children overall, the children are faring much better. We have seen in the international news that there has been an increase in the number of cases among children, an increase in the number of severe illnesses. So we are watching this carefully. While we do see an overall slight increase in the number of cases, in terms of hospitalizations and in terms of deaths, we are not seeing an effect where there's an increase as yet. Going back to the general population, in terms of active cases, we now have 4,635 active cases across the island, and this, of course, is coming down. And we can see that right across the island, all the parishes are affected, and with the most number of cases being in Kingston and St. Andrew and St. Catherine, and in St. James, St. Anne, and St. Thomas. Next slide. In terms of the number of deaths, we would see that the highest rates of deaths we have are in the parishes from on the western side of the island, going straight Manchester, going right around on the western coast to St. Anne. Next slide. In terms of the trends over the last couple of weeks, we are definitely seeing a decrease in the number of cases. And in terms of the numbers of admissions as well, the pink line that you can see is that the number of admissions are going down, and also the number of cases in the blue, and the 7-day average and 14-day average in the green and the blue lines. Right across the island, in each parish, we are seeing that the number of cases are going down, and this is a good trend, and we're hoping that this will continue, and we can get the numbers down even quicker to below 5%, where it is we want it to be. In terms of the other trends, on this slide we can see in red the number of deaths, and we recognize that with every surge that we've had an increase in the number of deaths. And unfortunately, for this surge that we are in now, has been the highest number of cases and therefore the highest number of deaths that we have seen so far. And so you would see that that curve is now on the downside, but we still have some cases that are under investigation. And so there is a potential for the number of cases to increase as we resolve some of those cases. Next slide. And this is looking at the number of deaths day to day during this surge. And we would recognize from the previous slide that the peak of the surge would have fallen somewhere between the last week in August, the first week in September, and accordingly, the number of deaths during that period would have increased at that time. And again, to show that some of these cases are still under investigation, and we can expect that there may be more deaths that are associated. A good trend in terms of bed capacity, we're seeing the numbers going down. Right now, you can see that we're approaching getting below the 700 line, which is the number of beds that we would have reserved for COVID cases. And as the number of cases go down, What it means is that it frees up the hospital to be able to manage other cases. Many other cases are waiting, persons waiting for surgeries, etc. It's very important to keep this trend going down so that we can resume some of the normal activities within the hospital. And here it is again, still at a level, I must say, very high level, which means that once it's over 700, but we have seen it go up to 1,200 and over, and it is now in the 800, 900 region. But once it is over that line, we are definitely having effect in our hospitals, and so it's very important to get it down. So it's still at a very high level of bed occupancy for COVID. Our reproductive rate is trending down, and this also is a very good sign, and of course is reflected in the number of cases that we are seeing. So it means that the measures that we have in place are in fact decreasing exposure. We have had the no movement days, and we have moved now to mostly curfews. It's important for us to maintain the curfews for a bit longer, while it is that we still are expecting to see the trends going down. Remember that it is below 5% positivity rate that we want to get to. Next slide. Next slide. Many persons have been asking about long COVID. Again, it has been covered quite a bit in the international news, and we're just going to spend 2 slides to just look at what exactly it is. So the term post-COVID conditions is an umbrella term for the wide range of physical and mental health consequences experienced by some patients that are present 4 or more weeks after SARS-CoV-2 infection, including by patients who had only initial mild or even asymptomatic acute infection. A person of any age who has had COVID-19 can later develop a post-COVID condition. The incidence of this post-COVID syndrome is estimated at 10 to 35%, while for hospitalized patients, that is patients who have had moderate, severe, or critical illness, it may reach as high as 85%. And these are some of the common symptoms that we will see: difficulty breathing or shortness of breath, tiredness or fatigue, symptoms that get worse after physical or mental activities, difficulty thinking or concentrating, a cough, chest or stomach pain, headache, fast beating or pounding heart, joint or muscle pain, pins and needles feeling, diarrhea, sleep problems, fever, dizziness, rash, mood changes, change in smell or taste, changes in menstrual period cycles. And you can see that this covers a wide range of symptoms, and pretty much all of the different organ systems could possibly be affected in terms of what's happening. And it's very difficult to diagnose and to say that it is specifically due to COVID. The treatment is managing the symptoms, pretty much just like when you have any viral illness, and you would take medication that will alleviate pain or fever or cough or diarrhea, or the treatment that you do is dependent on the symptom. There is no specific treatment that you're going to get for post-COVID symptoms that is going to resolve the symptoms and resolve the problem. It is a matter of managing the symptoms, so you can see your doctor, who will be able to prescribe something to help you to feel better. So the most important part of preventing these post-COVID symptoms, of course, is to prevent COVID and to prevent your likelihood of getting the illness, which is to wear a mask, maintain your physical distance, wash your hands, and of course, getting vaccinated against COVID-19 as soon as possible. And speaking about vaccination, this is what the vaccination coverage looks like now. We have 9.9% of the population that have completed vaccination. That means they have gotten 2 doses of a 2-dose vaccine, or they've gotten 1 dose of a 1-dose vaccine. We have 9.6% of the population that have received one dose and are now awaiting their second dose. 80.5%, which is still a large number of persons, are still unvaccinated, having not received either one or two doses. Across the country, we can see that there are some parishes that we're having a higher pick-up rate in terms of vaccination. So St. Elizabeth, St. James, Trelawney, and Kingston and St. Andrew are the parishes that we've had the best turnout in terms of vaccine take-up. And the other parishes are a little behind, and so we need to encourage persons from right across the island, because no parish is really in a good situation. Everybody needs to turn up at the sites for vaccination. We have fixed sites in all our parishes that persons can come to be vaccinated. So generally speaking, for indicators, we still have a high level of geographical spread, so it's not time to let your guard down. We still have a high level of bed occupancy. We still need to get that down so that we can resume normal hospital activity. We have still a very high transmission level, still in the 20s, almost 30% for a 7-day positivity rate. Our target is to get that down below 5%. The reproductive rate is trending positively, and it is below 1. We want to get it back below 0.5, below 0.3. And our vaccination level, we still need every person to come out for vaccination, because we're still at a low level of vaccination, and the level at which we are at will not be affecting our transmission level at this time. And that's the end of the presentation. Thank you.
Okay, thank you. Thank you very much, CMO. So I'm going to just, you've gotten a lot of information there. I know questions were asked about our children, and so CMO has hopefully adequately addressed the virus threat to our young people, and hopefully that would have satisfied those questions. Just a couple of other things before I ask the PS to speak to a matter. The issue of the digital vaccine cards, which I know has been a concern. We've seen cases of persons reported or allegedly having fake vaccine cards, and we've heard anecdotes around, the cost and that increasingly that is becoming a challenge. I'd just like to report that the concerns we recognize, and in addition to that, the announcement in other jurisdictions, the US, for example, where a vaccination is going to be required for persons or visitors going into that country, does require, as part of the infrastructure, a card that is going to be universally accepted and, of course, can be validated, and where the possibility of fraudulently producing a card is minimized, if not totally eliminated. The same approach clearly is taken with a passport, for example, which has digital reading that is possible to capture the data of travel history and so on. So in a sense, those of us who have a passport and have to travel would appreciate exactly what a digital card or vaccine passport would look like. We have to move there, and we have said so. And I just want to report that the intention is to see a digital vaccination card available to Jamaicans within the next 2 to 3 months. If it can be earlier, we will certainly do so. We are currently in the exploratory mode. We're working with a number of international partners, among them UNICEF, which of course is the software platform that we currently use to upload the information around persons who have been vaccinated, and that's a real-time information that we have. So we're discussing that with them, that entity and others, to create this digital vaccine card. We are seeking to have the card modeled off standards as seen in our major trading partners and neighbors, Canada, the European Union, the UK, and the US. And that, of course, is to establish the compatibility and, by extension, the acceptability of the card. It should take the form of a QR code and will be securely encrypted. That's the objective. And again, there's precedence for that. And so the conversation is around that kind of security feature. Persons will be able to print their QR code as well as to have it available digitally via SMS and email. So it's a code that can be read by a machine where the data can be uploaded or at least verified. So those who already have a physical vaccination card, what we will do once we have that digital card is clearly to transition that information to the digital vaccination card. So just to say to the public that we are working on that, we will ensure that we move speedily to get to that point, because we do appreciate that it's going to be necessary, and indeed for us in Jamaica first and foremost, to ensure that we manage the vaccination process and that we minimize the temptation for deviant behavior as it relates to the vaccination card. I should also just comment on the expansion of our vaccination outlets. Now, you may have seen on Monday of this week where we signed contracts being issued an RFQ with 11 companies, private companies, who will now be in a position to offer vaccinations in their outlets, and even via prearranged arrangements to go to the source of where the vaccine is being demanded. So we have 11 such entities, and they, combined with their outlets, will offer an additional 55 fixed vaccination sites. So in addition to the sites that we in public health are having to man out there in the field, and we do have fixed sites also, and then variable sites that we set up based on the blitz that we have. These 11 private entities will add some 55 additional sites. Just to mention the names: Vein Centers of Jamaica, Health Plus Associates, Online Medics, Fontana Limited, Portmore Health Complex, Windsor Wellness Center, Bay West Wellness Hospital, Winchester Surgical and Medical Institute, Winchester Labs, Hospiten, that's a private hospital in Montego Bay, Medical Associates, and the private practice of Dr. Michelle Holt at the Nuttall Medical Center here in Kingston. We are also looking at a few other proposals for our requests, response to a request for the proposals. So we are likely to add additional outlets, and the intention is to try and get as much coverage as possible. Over time, we do see these private entities playing an important role, both in outreach, in the messaging around the importance of vaccine, and of course offering the outlets. And that we hope will address some of the crowding effect that would take place normally in some of our key locations. This is a very important public-private partnership arrangement, and I want to thank the companies that have come on board. They will have to, of course, subscribe to all the necessary standards, the protocols that are already in place. I know a number of them are actually now employing or seeking to employ the medical personnel, the nurses, and so on. It is a bottleneck, meaning the extent to which they offer that service is going to be a function of their ability to get or to recruit those individuals. And I know that one or two have had some challenges. As we have always said, that there would be challenges out there as it relates to recruiting. But we want to encourage them to continue to pursue this, and encourage persons who can be engaged, employed, either on a full-time or part-time basis, to any of these entities, to make contact with them, because we do want to see these entities set up as quickly as possible. The final inspections, I believe, are and have been taking place with these outlets, and I am told that At least 5 of them have already been given full approval, 5 of the 11. And what that means is that, well, even though we have signed off on a number of them, they may have had to get a particular storage facility, a refrigerator, for example. And they were in the process of getting. So the ones that have been fully signed off on are either starting to offer or will begin to offer in the new week. And I'm sure they'll do their own promotion. We will assist them too using the ministry website and our social media platform and so on. So expect the extension of the offerings. They will receive vaccines from the various parishes and will have access to the ComCare system, and persons would be allowed or can set appointments to access the vaccines at these locations, and the information will be uploaded on the very same database that we use in the public space. Before again the PS comes in on his segment, I want to just quickly comment on expired vaccines. We would have said, and we'll repeat here, that come midnight, the expectation is that just under 60,000, maybe about 58,000 or so, vaccines from the AstraZeneca brand donated to Jamaica by the United Kingdom will expire. However, we are not out of AstraZeneca vaccines, and I want to make that clear. The expiration is linked to a particular batch of vaccines, the 300,000 that were donated. If we have just under 60,000, it means that we would have used up just over 240,000. So we would have used up the majority of that vaccine coming from that batch. We received the vaccines the end of July. I think it's the 30th of July. And when we received the vaccines with a 2-month period for usage. Now, normally these vaccines would have a 6-month period shelf life, but we got it 4 months into its usable shelf life. And so we had 2 months. Now, clearly our intention was to get take-up of all 300,000 doses. The efforts were there. The outlets have been established. The take-up only partially so. We have gotten up to 240,000. Our policy is that we do not administer vaccines that have expired, in keeping with the high standards that we have established for our immunization program, and therefore there was always the possibility that we would have not used up as much as was given during the period of time we were given to dispose of the amounts. And we are where we are today, with approximately 60,000 not being used up, which then will be discarded. There's a protocol for discarding vaccines that have expired. We are not unaccustomed to that protocol, given that we administer vaccines on an ongoing basis. It's logged, and there's a particular way to destroy, which will take place, and perhaps in this case, in consultation with the donor who has donated this particular amount of vaccines. Persons have been asking about the expiration date and linking that to persons being turned away from vaccine sites when they turn up early to or before their due date to get their second shot. And I appreciate and understand why some would be confused or concerned about not being able to get a job 5 days, 7 days, 4 days before the due date on their card. The clinicians are here, and if there are further questions later on, they can explain. But my instructions are, or information is, that the clinical guideline for administering the vaccines to get the maximum efficacy, the maximum effect, the best effect, is within 48 hours of the due date on the card. And so if you come 4 days before, 5 days before, 7 days before, then the clinician would normally advise to come closer to the point of the due date. And I think that some persons have had a big challenge or difficulty with coming 6-7 days. In fact, I've seen some online. Some have sent me concerns through the social media platform. But that can be commented on later on by the clinicians. But just to address it because it was raised to me and I had done some checks. The critical point here is that we have vaccines in stock. We have AstraZeneca vaccines. So if tomorrow morning you turn up at a location, do not worry that you're being given a vaccine that is expired, because that will not happen. The vaccines that will be available as of tomorrow is a different batch of vaccines. In fact, 390,180 doses of vaccines is in stock, and so people and vaccines available to administer in the country after today. That's a lot of vaccines, a large amount single dose, 178,000, and then of course the AstraZeneca over 390,000. So we're saying to Jamaicans, please, if you have not yet gotten your vaccines, or you need to get your second dose, or you need a one-jab vaccine, we have in stock. Go to a site that is available, either offered through the private window or public, to benefit from this. Up to 4 p.m. today, we had administered 781,496 doses of vaccines. Of that number, over 506,000 first dose, 246,000 second dose, and 28,000 single doses. That's the Johnson & Johnson. We know we have to do some work in terms of the communication as we continue the outreach into communities, either the ministry, the mobile buses, the health centers, or the private entities. We're going to have to build some awareness around, for example, the Johnson & Johnson vaccine, because the take-up has been slow. The truth is, however, we were hoping to use the opportunity up to the expiration of the AstraZeneca batch from the UK to focus on that vaccine. Now that we are at the close of the expiration time period, then we are going to now recalibrate and redirect some of our energies to pushing what we have available, including the Johnson & Johnson. Okay, so at this time I'm going to invite the Permanent Secretary to provide us with some insights into the extent of the expenditure of the vaccination program. Thank you. Yes.
Good afternoon, Minister. Good afternoon, members of the public. Just by way of information, we had been asked to provide a report on the financial status. The Minister has already provided information on the stats in terms of where we are with vaccination to date, and so I won't go over that, so I'll move to the next slide. And as you can see from the next slide, we have received a total of $5.6 billion in terms of income from the warrants that have been issued. Now, a warrant is an instrument from the Ministry of Finance and the Public Service that allows ministries, departments, and agencies to utilize cash. And it's an instruction from the Ministry of Finance that tells the Accountant General's Department as well as the ministry how much resources they have to utilize for a particular activity. And under this activity called COVID-19 response, we have received $5.6 billion in warrant from the Ministry of Finance to date. And this is up to September 15, 2021. Of that amount, we have utilized $5.1 billion. And so we have a cash balance of 498, approximately $500 million. So if you recall the budget presentation, a total of $8.66 billion was allocated for financial year 2021-22. And of that amount, we have been, the Ministry of Finance has provided 64.8% or approximately 65% of the amount allocated in the budget to the Ministry of Health and Wellness for distribution. And we have already spent 59.03% of the 8.66 billion that we have received to date. Now, month on month, we see where, in terms of the cash that has been released to the ministry versus the cash that has been spent by the ministry. And we recognize that in most months, with the exception of June, we have received more than what we have spent. And our average utilization is around 91%, with the exception of the month of June, where our central payment account had excess balances and therefore it had to be corrected. And that correction occurred and we were able to recover our 9% average variance rate in terms of expenditure versus income. And we were maintaining that up to September 15 when we have presented this report. Finally, in terms of our payments, the largest amount that we have expended on, or the largest category of expenditure, is our transfers to the regional health authorities. Now, the regional health authorities are the operational arm of the ministry. Regional health authorities are what we call public bodies, and they are governed by a separate legislation. Now, the Ministry of Health and Wellness is responsible for the management of the budget for these regional health authorities. And so the operational function of healthcare delivery is undertaken by these regional health authorities. And under the COVID response, the operational aspects of that program is managed by the regional health authorities. And so 32% of the total expenditure since the beginning of the financial year has been to the regional health authorities. And rightly so, because they are the ones who pay salaries to the staff, the incentives, and the other operational costs related to the COVID response. The other area of expenditure that is significant is our payments for vaccines. 17% of the total expenditure to date has been for the payment for vaccines. And these payments relate to our purchases through the African Medical Supply Platform and the WHO COVAX facility. However, you will note that over 80% of the vaccines that we have received to date have been due to donations, and therefore there is some savings that we have realized in that in the program, and that is a function that we will discuss in terms of the presentation that the Ministry of Health and Wellness will make to the PAAC on Tuesday in terms of the reallocation in the supplementary budget. 11.89% of the expenditure has been for medical equipment and the purchase of different support for field hospitals and other interventions for patient care, the purchase of PPEs, etc., for staff in terms of their own safety. And finally, 3.95% of the amount expended to date has been for PR and communication. That value works out to be approximately $202 million to date. As the minister said, we do have vaccines in stock, and you will see from the presentation we have 390,000 doses of AstraZeneca that are for the continuation of the vaccination program, and we have 178,000 doses of Johnson & Johnson. And so in total, 568,000 doses of vaccines are available for the continuation of the program. And so persons will be able to visit their vaccination centers tomorrow and continue the regimen of vaccines being administered at this time. Thank you, Minister.
Thank you very much. So there you have it. This is our expenditure to date. We have explained that the issue of the donated versus purchased vaccines. There are two methods of achieving vaccine numbers or access or supplies. One is through diplomatic channels, because there are some brands that have been purchased and future purchased by some of the larger countries, purchasing and storing or ordering in advance. And even though we have had the resources to purchase, we have had difficulties accessing because production lines have been bought up into the future. So take the Pfizer vaccine, which I know we are still waiting on to complete the process that we had started. And there are some expectations that we should have the next shipment in this early month that is about to begin, October. People ask the question, why not buy? Why wait on the gift? Well, the straight answer, simple answer is if we could access the supplies, we would certainly buy, because we have the resources to buy, to purchase. It's just not available. And the way to access that particular brand is through the channels that are now in play, which is diplomatic conversation, a willingness to gift, and then, of course, the logistics that accompanies that. We have bought quite a number of Johnson & Johnson because it was available to be purchased. 1.9 million doses to be specific. And we are receiving and will continue to receive in the months to come. We have bought through the COVAX facility, which is the WHO-backed facility, and we have received some amounts of that. Not what we were promised to date, 700,000 doses. We have gotten, I think, 200 plus, and therefore anticipate to get more. That's because that very facility has had issues accessing from manufacturers. So the vaccine diplomacy has been a very big part of the management of the process and the access to vaccines. And in many instances, we have been the weaker party in the negotiations, put it that way. And therefore, we have had to wait. There have been circumstances outside of our control, which is why we're challenged to date. On the issue of vaccines, I just want to say that we are still waiting on a firm date on the Pfizer vaccine, the next shipment from the U.S. It's important to say, though, that outside of the commitments for second dosage, the intention around the Pfizer vaccine is to focus on our young people, our children, because that is the one that was tested, tried, and approved for the 12 to 18-year-old. So just to say to the adults who may be waiting on Pfizer as a first dose don't wait unless there's some medical reason that your doctor prescribed. You are not likely to be given any priority, except for the fact that you are getting your second dose, which clearly requires you to get it. We're going to be focusing on our children because in the weeks and months to come, we really need to get our children back into the classroom, face to face. They're really suffering, and it's to all our disadvantage. And I just want to say that this is where we're going to be headed. I want to just outline too at this time that we have launched a new electronic solution for the registration of the elderly and disabled and shut-ins to receive the COVID-19 vaccine. A number of persons have been asking, what if my mother or grandmother can't come out of the house? They're wheelchair bound, they're not well. How do we make arrangements to deal with those persons, whether they're in an institution or in a private home? Now, we have done a lot in terms of the institutions, the infirmaries and so on, but we do appreciate that persons, for one reason or another, may not be able to come out to a vaccination site. So this online tool is currently accessible through the Ministry of Health and Wellness website, and we invite you to visit the website. And when they say we, it doesn't necessarily mean the shut-in. It means their next of kin, their children, whoever is their caregiver. Visit the website. I think it's on the screen now, at least showing how it is set up. It's intended to support efficient planning for the complete vaccination of the elderly, the disabled, the shut-ins who are otherwise unable to access the COVID-19 vaccines at designated sites island-wide due to mobility issues. So the tool is designed to provide data to determine the demand, the geographic distribution of those requesting a home or institution visit for the vaccination. No personal health information will be collected, so your personal health information will not be included in that. It's not a registration tool, so it's not that you're registering in the traditional sense. It's really to provide information so then we can be in touch. It's completed for the elderly disabled seeking to be vaccinated. The tool allows the persons completing the form to indicate that the person being registered is in an institution or private home. The parish health department will review the geographic distribution of the registrants and make contact by telephone in order to confirm an authentic request and to schedule and undertake the visit to the home or institution for the vaccination intervention that is necessary. So we're hoping that this platform will be accessed by the caregiver, the family member, that the information will be uploaded. We will then use the parish health team to make contact, and then we'll make an appropriate arrangement to ensure that the shut-ins receive their vaccination. Finally, just to again thank all who have been continuously working on this process, our healthcare workers who are on the front line. It's been a long haul, and I know it's very challenging, even though we are still in the red zone as it relates to the third wave. We are seeing some numbers coming down, which is encouraging, the reproductive rate below 1, for example. But it does not suggest or should not suggest that we should be complacent. The vaccination program, we really need to make good on by having more persons going out. Outlets are being expanded. We're going to have to pivot on the messaging. Community outreaches are being organized. And we really want to urge Jamaicans to see the vaccination as the best hope for returning to normality. Thank you very much, and we will now open the floor to questions.
At this point, we invite the members of the media to utilize the raised hand feature in order to take your set of questions. We begin this evening with Jacquiline McLean from CVM. Jacquiline?
Yes.
You can go ahead, Javine.
I can.
All right, while Javine sorts himself out, we'll move to Roxroy McLean from the Gleno.
Good evening, everyone. My questions are for Dr. Ennis. Dr. Ennis, can you provide a report on the number of serious adverse reactions to the vaccines, as well as the number of persons who have died after getting the jab? That's one. And two, when will it be safe for children to return to face-to-face classes?
Thank you very much for your question, sir. To date, we have received 353 ISAVIs, which are reports that are supposedly attributable to vaccination or immunization. Of that figure, we have classified 72 as being serious. And when we speak to serious cases, we look at persons who have been hospitalized, persons who may have had temporary or permanent disability, persons who may have died after being vaccinated. If it is for a child, we look at persons with congenital or abnormalities at birth. So we have 72 of such serious cases. Of those, we have closed about 17, looking at the vast majority of the 72, over 56% of the 72 would have resolved completely. Those cases that we looked at were persons who complained mainly of being dizzy, which was transient. We did have a few who were hospitalized for allergic reactions or for palpitations, and all of those have resolved. We looked at 11 persons who would have died after receiving the vaccine, 9 of which we have found to be coincidental based on our causality assessment. 2 we have classified as being indeterminate, and we say so because of the temporal relationship that occurred. So we are not sure what is happening, but it happened around the time of being vaccinated, and the classification of intermediate temporal is an international classification used when we do causality assessments. For your second question, sir, as to when we can go back to face-to-face in the classroom, we're not sure. We continue to look at our vaccination rate uptake. We also need to look at what is happening in country, our positivity rate. We need to look at all of that in order to make a determination. Please also be reminded that we are awaiting on Pfizer doses to come into country. We will be administering second doses to children and to ensure that first doses are also offered to children. And as soon as we have adequate uptake, we will be considering that avenue of going back to face-to-face classes.
Thank you, Dr. Ennis. Javine, we come back to you now. Please go ahead.
Hello.
We're hearing you, Javine. We're hearing
sorry.
you. Yes.
Oh my God. Sorry about that. Yes. I have a question for the minister. Yes. So some first world countries are mixing vaccines. Is that something that Jamaica can look into?
So that's not a question for me, but thank you anyway for giving me that status. I'd allow the... Dr. Ennis, you want to respond to that?
Pardon me, sir, could you please repeat your question? Thank you.
The issue of mixing of vaccines. Countries are doing it, why aren't we doing it, is the question.
Okay, thank you very much, Minister. So Small studies have started in various countries looking at mixing. And so far in these small studies, the reports are seeming to be positive that there is no untoward effect with mixing, and the immune response is noted to be good. However, please be reminded that we do have to have a larger population of persons so that we can extrapolate to say it will happen the very same way in Caucasians, in Black persons, persons with different environmental areas. And that's why larger studies are conducted. So this is a good stepping stone, but as further investigations and studies continue, it is until that time when we get the go-ahead from the World Health Organization, as well as the manufacturers, that we will consider implementing same in country. But we continue to watch and follow the science, and as soon as that green light is given, if it is acceptable, we will consider same.
Thank you, Dr. Ennis. The next question goes to Alfio from the Jamaica Observer. Alfio.
Hi, good afternoon. I have two questions. The first one is a follow-up to the question regarding adverse reactions from the vaccine. If the PS could say that the compensation mechanism that was set up, has anyone made a claim, and have there been any payouts? The other question is in regard to the digital vaccine cards. Dr. Tufton, the 2 to 3 month timeline that you gave, is this for actual issuance of the cards, or is it for some kind of tender process?
All right, thank you very much for the question on the compensation mechanism. So as you would recall, Jamaica has not set up a formal compensation mechanism for the vaccination program. What we have done in our local jurisdiction is to indemnify the manufacturer. However, liabilities around vaccination still relate to the government's or the judicial review and the judicial examination and the award of compensation based out of that normal process of persons going through the legal system. So right now, no such claim has been laid against the government of Jamaica in terms of the vaccination program.
On the issue of the digital vaccine cards, the timeline given would be for production and distribution. As you produce, you would distribute. So we're hoping that we can produce the card and begin distribution within that time frame.
Thank you, PS. Thank you, Minister. The next question goes to Zara Burton, 18 Degrees North. Go ahead.
Hello, good evening, everybody. I'd like to ask Dr. Ennis, following up on Roxroy's question regarding the adverse events, if there are any children that have received any adverse events after the vaccination, and if yes, what kinds, and any serious or no. Also, in the UK recently, there was a recommendation from the CMOs in each of the member countries of the United Kingdom that said that the 12 to 15-year-old category would get the first dose of the Pfizer vaccine, and the second dose maybe not until next spring, when the effects could be studied a bit more. Have the team, or has the team here in Jamaica given any thought to just vaccinating one dose for the teens instead of the full 2 doses?
Thank you very much, Ms. Burton, for your questions. Again, I'm going to your second question about the decision that's taken in those countries. Those are the decisions of those sovereign states. As we continue to remind persons here that we do take counsel from the Strategic Advisory Group out of the World Health Organization as to the administration of these vaccines, as we do with other medications. And it is once we have certification, ratification from that board that we will begin to execute. So, countries can decide to adopt whatever method they wish, but we do take counsel from this known and reputable authority before we institute here in country. With regards to your first question about children, we noted 3 serious, what we classified as serious events following vaccination in children. 3 children were hospitalized for observation 24 hours. They have all resolved from the symptoms that they have that they displayed and are well at this time.
Thank you, Dr. Ennis. The next question goes to Dion Jackson Miller, RGR. Dion.
Okay, thank you so much. My first question relates to the issue of the vaccination card, and it relates to a report that we carried this week on my program. Not an allegation, Minister, an actual account of a Jamaican who is now in the Netherlands and whose card has been refused. To be clear, not because it's analog, not because it's AstraZeneca, or not because it's a Jamaican program, but because the card itself does not have the information that's needed. The manufacturer is listed as COVAX Sweden. The authorities say that's not a manufacturer. The name of the vaccine isn't listed anywhere at all. And as a result, she is now having to consider whether she needs to actually be vaccinated all over again because of the uselessness of this card. Since we aired that story, a number of other people have called me and messaged me sharing details. And the CMO does have a copy of the card, Minister, a copy of the picture of the card. Since then, a number of other people have messaged me because they heard that, went and looked, and a number of people are reporting similar problems. No name of the vaccine on their card and so on. So I'm asking, first of all, in relation to this particular Jamaican who is now in this quandary in the Netherlands, what would the ministry suggest she do? How can the ministry help her? And second, in relation to anybody else who may have cards that are improperly filled out, what should they do? And how does the ministry plan to address this going forward? So that's one issue for me. The other issue would be whether we can get more information on the issue of the adverse reactions as to what exactly, perhaps a little bit more of a breakdown. Could we get more of a breakdown? And for instance, when we're here, 9 coincidental, 2 indeterminate, is it that the 2 indeterminate, doctor, we would never be able to know what is going on? Just trying to get a little bit more granular detail on that. Thank you.
All right, so I don't know the specific case you've mentioned. You said that the CMO has the card, so I'll consult with her. What we do have that is easily verified is the database of persons who have been inoculated, who have been vaccinated. So we could easily run a check against any particular individual who has a concern or has had an issue of that kind. And if the card in their possession has an error, and if this particular circumstance is because of missing information that should have been there, then verifying that the person was in fact vaccinated, because there may also be some fraud in the system, as I've said earlier, it would really be to issue a new card with the information that should be there. If you're saying, on the other hand, that the card is just inadequate, meaning that there is no category for information that is required by that particular authority, that particular country, then clearly it would be a bigger problem. And it would mean that we would have to look at that particular circumstance. I know the cards are used elsewhere, so I don't know if that particular sovereign state has unique requirements, which is exactly why I said we, in putting together the digital card, we have to benchmark against the best practices, the international standards, and in particular against the jurisdictions that we are most likely to interface with. And that's why we are consulting with the UNICEF, with other global bodies to arrive at a card with the appropriate features that are globally accepted. And then, of course, the digitization that will allow that kind of issue that you have just raised not to reoccur. That would be the medium-term solution. So information, Dion, and if there's missing information. I don't know if the CMO has or would like to comment a little further on it since she has that card or a copy of it. CMO?
Right. So I think that there was a genuine error on the card that you shared with me. And what I would suggest is that if that person is still having difficulty, perhaps Dion, you could share my contact information with them so that we can see how best we can assist them while they're overseas in clarifying the matter. But in terms of the other persons, I would imagine if it has happened once, that it may have happened several times also to other persons. I would suggest that persons contact their health department if they're having doubts to see how it is that we can correct those any errors that there are. Unfortunately, it is a human system, and there are likely to be errors, but we do have the potential to correct them and to try to rectify the problems as soon as possible. So just contact your health department if you are having an issue, and let us see how we can arrange to replace the cards, because we do have the correct information. The information is documented, so you can be certain of that we will know that you received the vaccine, we will know which type of vaccine that you got, and we will know the batch and code number so that we can put the information there. And I will, going forward with this digital vaccination card that the minister has spoken about, certainly the consultation will be with several entities so that we can be assured that the requirements from different countries will be taken into consideration in the information that will be put on the card so that we can ensure that there is universality of acceptance.
Thank you, Minister. Thank you, CMO. The next question goes to Janet Silvera of the Gleno. Janet, go ahead.
Thank you very much. My questions are, one to Dr. Ennis. Can you say which vaccine we're having more adverse effects from? In other words, and which one of them more persons have died after taking? And I'd also like to find out what is the current situation with the challenges that we've been having with the UK in relation to the UK saying that it's not the Jamaican code, it's not accepting the Jamaican code for AstraZeneca. Can we get an update on that?
Oh, thank you, Ms. Silvera. Let us start with your first question about the adverse events. So we have received a number, and we are doing the comparison, trying to look at the exact figures, and we may see a little bit more adverse reactions with the Pfizer vaccine at this time. Now, you have to put that in context. We are administering this vaccine to children who will complain more of the pain in the arm, the flu-like illness, who will also be very fearful of the needles, the children who will have a fainting episode or a syncopal episode, complain of dizziness. So all of that, putting it into context, gives us a little bit more with the Pfizer, but we do understand and recognize that that happens when children, especially adolescents, are being vaccinated. We do take special precautions with them. And all of those instances, as mentioned, have certainly resolved. We did see an increase in dizziness, and that was indeed momentary. It happened at the vaccination site. Children were allowed to lie down, and in 10, 15 minutes, they were okay and would have left. And we have had no reports of any further adverse events following those incidents that occurred.
Thank you, Dr. Ennis. The next question goes to Dion Jackson Miller, who has a follow-up. Dion? Dion? All right, we will then move to Zara Burton.
Hi, Dr. Ennis. Just following up on Dion's question about getting a more detailed breakdown in terms of how many from the AstraZeneca, how many from the Johnson & Johnson, how many from the Pfizer, the gender of people, the ages. When can we get a more, let's just say, condensed, like comprehensive, let's say, report from you on adverse events? And also, just to confirm, so the 3 serious events that you talked about with children are dizziness. I just want to confirm that. And also the ages of these children. When you say children, I just want to make sure what the definition is. And what were the symptoms? So.
No, I did not say that the 3 suffered from dizziness. The 3 I did say were hospitalized, and their condition resolved. The symptoms that they displayed would have resolved completely. I made the point of dizziness as generally what we see as one of the more common adverse events as we administer all the doses, and we have seen a little bit more with the Pfizer vaccine at this time. The children, the ages of the children are between 12 years and 17 years old for those that we would have considered as being serious events. You also wanted more details on the numbers and the gender. The vast majority, you can get a more detailed report without necessarily, of course, speaking to the symptoms specifically that persons would have been treated for. But we can give you the gender breakdown. In general, it's more women that have presented with these challenges. For the Pfizer vaccine, interestingly, it is our boys, our young boys, who seem to be having more of these side effects.
Thank you, Dr. Ennis. Janet, you have the floor.
Thank you very much. Only a part of my first question was answered, and my second question was totally ignored. The one in
Janet,
relation,
please repeat, yes. Please repeat, Miss Janet, please.
Right, I asked about which of the, as it relates to deaths, which vaccine you saw more persons dying as a result of taking the vaccine. And the second question was, as it relates to the UK not recognizing our code, has that been resolved? Where are we with that? Can we get an update? Thank you.
Okay, so for persons who have died after taking the vaccine, we have seen deaths after taking the AstraZeneca vaccine. I have not investigated any deaths after the Pfizer vaccine at this time. And I hand over to Minister or the PS to answer the question regarding the UK.
Right. I just want to follow up on that, just to remind persons that in terms of the events supposedly attributed to vaccines, which the ISAVs are, it is anything really that happens to a person after they have been vaccinated. And what it is that our investigation is to determine that there is the cause is it or is it not the vaccine. So while we have had deaths in persons who have taken the vaccine, either 1 or 2 doses, we have not attributed cause to that it is the vaccine that caused it. So when you say that which vaccines have resulted in deaths, the question that Dr. Ennis is answering is, what reports have we had from persons who would have taken either of these vaccines that there would have been a death? It's not necessarily, it's not a cause. We have not established any cause.
Okay, thank you very much for that clarification. On the issue of the AstraZeneca UK acceptance of the batches that were not produced in the UK, I think that was the issue. There have been some discussions taking place between the Ministry of Foreign Affairs and Foreign Trade and the UK government, and I believe some progress is being made, but I can't comment definitively on what the final position is. I will have to consult with the Minister Johnson Smith, and I'm sure she will provide information when an agreement of some kind is reached, and we'll make it available to you. But talks are taking place.
Thank you, Dr. Ennis, CMO Minister. Dion, please go ahead. In the meantime, Dion, you ready?
I am.
All right, go ahead.
Thank you. My apologies about earlier. I'm juggling live radio and live press. So, in relation to our card, following the conversation with Dr. Adair Morgan, Minister and CMO, she had indicated that the Dutch authorities had said the card needed to indicate manufacturer as well as vaccine. So when I look at our card, there's a space for manufacturer. And for instance, on my card, in that space is written AstraZeneca. And as I know you all are aware, AstraZeneca is not necessarily the manufacturer. For instance, if it was the SII in India that made the vaccine. So I'm actually wondering if the card itself needs an additional line so that manufacturer and vaccine would be separated out. I did hear the CMO said that we're looking at the best practices when producing the digital card, but perhaps since this has already been flagged in at least one jurisdiction, should it be something that going from here is written onto the card so that both those bits of information are captured separately?
Thank you very much, Ms. Dion. That is indeed how we are moving forward with printing additional batches of our vaccination card. We do have, and we will be sharing with the field, all the manufacturers for the various vaccines we have received, the batch number and the vaccine product name, so that there will be no challenge with writing on the cards as we go forward.
Thank you, Dr. Ennis. Debbie Ann Wright, please go ahead.
Good afternoon. Some time ago, the Prime Minister had said the Foreign Affairs Minister was in talks with, I think it's a regional country in relation to getting some Pfizer doses in until we can receive the ones from the US. How has that talk been going, Dr. Tufton?
All right, so there was one of our neighbors in the region that had some supplies of Pfizer, and I know the conversations were taking place. The conversation involves not just the willingness to give and the willingness to receive. It also expands to conversations with the facility which made the vaccines available in the first place, and the manufacturers who have very rigid, very strict rules as to how the vaccines are utilized once they are made available. In the long and short of it, of course, is that those conversations continue because they have to be triangulated, if you will, to other sources before a decision is finally made for approval, and then you deal with the logistics of it. So that's what is happening now.
Thank you, Minister. Finally, this evening, we have a final question for Dr. Ennis coming from Area FM. And it reads, following complaints of people being turned away or told no, they can't get vaxxed when they went earlier than due, will the ministry now reconsider and allow those persons to go tonight for their second dose in order to use up the batch that is about to expire? And of course, this despite their not being due as at today. Dr. Ennis? Oh, CMO, please.
Right. So I want to just remind persons that we are not out of vaccines. So if you have a due date, then that is a time that the 8 to 12 weeks that we have given is the time that the manufacturers, the studies have shown that it is the best efficacy to get the vaccine at that time. Now, so if you have a due date, then the best thing for you to do is to go on the due date. The vaccines are not running out. They're not running out, so, but if persons have missed their due date, then certainly they should try to get to the vaccine center this evening so they can use up some of those that would expire later on. But if you have a date for tomorrow, for next week, we have vaccines for you, so go on your due date.
Thank you so much, CMO. Minister, it's over to you.
Thank you. So let me thank the CMO and the PS and Dr. Ennis for coming on, as usual, to provide information. Thanks to those who have been on and they ask questions. We're always intending on providing as much information as possible. And we will continue to keep you informed. We're going to be having another Zoom discussion right after this with the diaspora, hosted by our ambassador in Washington, D.C., Ambassador Audrey Marks. And I'm sure the conversation will be around COVID and many of the other issues that have been raised. So you can tune into that on our page and on the Facebook and all the other addresses that I'm sure have been advertised. That starts at 6 p.m., which is in 18 minutes, right here at this location. But I'll be the only one on the witness stand, I believe. My other two hosts are leaving me. Thank you very much. Yes, there was some queries around an accident, an unfortunate incident involving a ambulance taking a patient through the parish of Clarendon. It happened this morning at about 10 o'clock. The information that I have up to this point is that the occupants of the vehicle are alive, are being treated, and their condition as of now is not considered serious. Am I correct? So we certainly pray for their speedy recovery. Again, another indication of the challenges of the type of work that we do. The emergency team have to maneuver sometimes, and based on what I heard, they had an unfortunate incident which led to the hospitalization, but we pray for their speedy recovery. Thank you very much. Have a good evening. And those who would like to join after 6 o'clock for the diaspora discussion. Thank you.
Are working very hard to ensure lives are saved and people recover quickly from COVID-19. But their work is becoming harder because you're not wearing your mask, washing your hands with soap and water, or using hand sanitizer, and you are not maintaining physical distance. Let's limit the need for hospital beds and ventilators. Do the right thing. Cover your nose and mouth with a mask. Practice good hand hygiene and maintain a physical distance of 6 feet between you and others. COVID-19 is not over. Protect yourself while protecting others. A message from the Ministry of Health and Wellness. COVID-19 is still here. Always wear your mask correctly while in public places, covering your nose and mouth at all times. Masks should never be worn over the head, under your chin, below your nose, or hanging from your ears. Recovery from COVID-19 can take up to 60 days or more. The mask or the ventilator? You choose. A message from the Ministry of Health and Wellness.
The following is brought to you by the Office of the Prime Minister.
When your turn comes for the vaccine, please take the vaccine. It is absolutely important. For those who have hesitancy and fear, and all of that is legitimate, it's healthy. But I believe we have seen the vaccine at work. We know what the risks are. There are no riskless activities in life. We urge you to participate in the national program